And here with us in studio this midday is Cathy Costello and her daughter Anna Marie. Cathy's husband and the father of Anna Marie and 4 other children, State Labor Commissioner Mark Costello, was stabbed to death this past August. Her son, who suffers from mental illness, is in jail for the murder. Cathy and Anna Marie, thank you very much for being here with me today to talk about this difficult subject. Really appreciate it.
Having us. Important conversation.
Yeah, it really is, and it's one that doesn't get discussed often enough. Why do you think that is?
I think there's a stigma, and the stigma is due to the lack of education. People don't seem to understand what mental illness is, and it is a chemical imbalance in the brain. You know, our body has organs, and sometimes they malfunction. If you have high blood pressure, you're going to take medication so you don't have a stroke, or if you have diabetes, you take insulin. The brain is an organ. When the chemicals become imbalanced, it needs medication to bring that back into balance. And then the symptoms present oftentimes in a manner that can cause harm to the person who is suffering or to others.
Your story with your son and your father is well known. It's made headlines even nationally. But what many don't know is that you and your husband always feared that something like this might happen. What were some of the signs?
Well, one of the main signs that we saw the last 2 to 3 years was prevailing and increasing paranoia. So because Mark worked for the government, he was the State Labor Commissioner, he had fixated on the possibility that he could be spying on him, his computers, his phone. He tore his apartment apart trying to find cameras and was convinced that he was spying on him, like he was having the FBI following him. And he became more agitated about this, and we had heard that he expressed great concern, and there had been some violent outbursts. And because of the paranoia, his focus of being angry at specifically his dad made us fear that he would do something to hurt him.
And how do you have a conversation about mental health with somebody that already isn't thinking rationally? How did you approach that?
Oh, and well.
Well, that's why we're here. That's why we are choosing to be proactive with mental health, mental awareness, not just in the state of Oklahoma, but nationally. We're not the only family that is affected or suffering from a loved one that suffers with mental illness. And we need to have a dialogue, we need to have the education, and we need to be proactive about this very, very serious issue. So to answer your question, that's why we're here today. That's what we're getting started. We're going to figure this out.
Well, and I think it takes more than just a mother or a father. I think this does become a community issue, because unlike those other illnesses, mental illness affects in a broader way. And we've seen what happened at OSU. We saw what happened. My husband was tragically murdered in front of me and in front of 20 other people in a workplace. Conversation with doctors, conversations with the community, understanding from police officers who show up at situations where someone is in a crisis to recognize that they're ill and not a criminal. So they go to the hospital or a crisis center rather than the jail or prison, which many times we know they're full of people with mental illness. They're in the wrong place.
So maybe more training for police officers and the public.
We have some CIT officers, our crisis intervention teams. They have 40 hours of training and education on mental illness. It helps a great deal, but we need more. I believe we need every police officer to have this information.
And Anna Marie, I know you were very close with your father. You didn't just lose your father here, you've also lost your brother. How do you cope with something like this? This really is a family disease.
It is. If there's a rule book or guidebook, I'll take it. You know, I'm taking it day at a time, a moment at a time. You know, like my father, I was crazy about my dad. He was my man. I looked up to him. He was my hero. But just as much, I also had a great deal of love for my brother. And I think it's not just that I lost my father, I also lost my brother. And for me personally, my brother was my first best friend. He was my first playmate. I knew my brother in the healthy manner. I remember making mud pies with him. We would play, pirates, or, and I'm the oldest by 2 years, so oftentimes I got the playtime that I wanted. But I know my brother in a healthy way. Now, I'm the oldest of 5. Now, my youngest brother, We are 12 years apart. So he knows his brother in the unhealthy way. So for him, he knows him to be sick and paranoid and to be unhealthy. And for my younger siblings, it's been difficult for them, but for me, I've seen all, I guess, steps of watching my brother progress into this very ugly disease. So it's been difficult. It's not been easy, but like I said, we're not the only family suffering, who are frustrated, who want answers. And I love my brother. To this day, I love him very much. And I will do whatever I can do to help bring awareness, education, to be proactive. I'm not the only sister and daughter out there who's hurting.
And clearly you both are, understandably. How do you remain so strong?
Through God, and I think through the Spirit of our Father. I have great parents, and I recognize that, and I'm holding on to that, and I'm appreciative of that. I'm also very appreciative for the years that I had with my father. Some of my friends, some people, I hear, oh, I can't stand my mom, or I don't have a good relationship with my father, and that breaks my heart because I do. And for whatever reason, I have a beautiful relationship with my family. I would do anything for my family, including trying to get help from my brother, even while he's in the state that he's in. I still love him very much.
I'm so sorry for your loss, and I've got to tell you, I have a friend that was friends with your father, and the minute he found out the news that he had passed away, he was heartbroken, and even said just what a great family man he was, and how he even looked up to him.
He was the best,
Makes me cry.
and he loved his son so much. He never quit reaching out to him. This is something I really would like the people of Oklahoma to know. He knew he was sick. He knew he could be off his medication. He announced he was not taking his medication the day he murdered my husband. But my husband would never give up on trying to reach him, have a relationship with him, tend to his needs, his physical needs, food, clothes, shelter, medication, and a relationship as a father. And there's no father that tried harder. He really laid down his life for his son.
And what are the steps as a parent that you do take? Is there a right way? Is there a wrong way? How do you know what you're doing?
Be realistic. I know that there are some families, and I've talked with other people who've said, in my family, I had a sibling that obviously was developing symptoms of mental illness, and they just, well, not in our family, and they looked the other way, and that's not a help. Early intervention is important, I believe. And to be realistic, if you thought your child was looking tired or anemic and they had cancer, you would get to the doctor as soon as possible. When we began to see symptoms in our son, we sat down and talked with him, and in the beginning he was willing to go with us, and the first thing I did was look for a good psychiatrist, then a good therapist. I spent unbelievable number of hours day and night researching medication. We eventually found out that my son had a genetic issue with his liver, where some medications he metabolized so quickly they didn't cross the blood-brain barrier, so these medications weren't working. I mean, there's a lot of science here, and these are tests. A good doctor will say, let's make sure the medication you're taking is even working, because some things he would be on for a year and nothing was working, and then we found out why. But to be proactive, don't be ashamed, get into therapy. We joined NAMI, National Alliance of Mental Illness. My son went with us. He went in one room with those who suffer with mental illness, and the family members went in another room. It was great. It was a great support. We helped one another. He would talk with parents to help them understand what he was going through. That was a great time a few years ago. It fell apart. But there are things, there are support groups, there are things in Oklahoma City, like OCARTA, that helps people who have addictions and mental illness try to get back on their feet and develop relationships. It's a free service. So there are things available.
There are things, I think people need to understand with mental illness, at least for my brother, he had a severe paranoia. I guess to put it simply for people who don't quite understand the mind of someone who's suffering with mental illness, I always suggest the movie A Beautiful Mind with Russell Crowe. It kind of shows how it kind of gets into the mind of someone who's suffering and how they perceive the world, and how those paranoias to that person is very real. Even though it's it's not realistic or even accurate, to that person it's very, very real. So I guess as a simple stepping, understanding, I always suggest that movie. And I think people also have to understand is that it wasn't overnight. He wasn't well and then boom, dare I say crazy. It was a slow progression. There were signs, there was behavior, there were things that he would say. Changes in the season were always very difficult from fall to winter and generally spring. His mania was very uplifted and agitated. So there were progressive signs. So it took about 8 years for him to go from the healthy brother that I knew to this really manic, violent, person that he became the day that he felt like he needed to do something about my father. That's not who he is. His mind is sick. We understand that. It doesn't take the pain away any less, but for us just to sit down and just to say, well, we're not the only family that has lost a family member.
Well,
there's been 2 others that
actually, and then 2 other families in this week I've learned of another family. So I know of 3 families where a parent has been murdered, stabbed to death actually, by a mentally ill son, and in all 3 families they were trying to find answers. Insurance is a big issue. I know my husband and I spent out of our own personal pocket $150,000 trying to help him. Our son had been in and out of crisis
3 years.
In the last 3.5 years, 3.5 to 4. But in the last 12 months, he'd been in and out of crisis center, hospital, Griffin, St. Anthony's 5 times. What do families do that don't have insurance or very good coverage?
Who do you call?
And so this is very important. The next thing I'm very concerned about is that when these people come out of the crisis center, your crisis is over. Do you have medication to follow up with? Do you have a doctor to see? Do you have a therapist? Oftentimes, I was in situations where I would find out he was out, there was no medication, they would say, go see your doctor. Well,
there was one time he was let out because of this whole HIPAA program. We were not allowed to know where he was at times, or how he was doing, or the progress that he was making or not making. And I remember one time they let him out on a Friday night, 10 p.m. It was cold. He was on the streets. That was dangerous for him and possibly others.
Right, that's true.
Again, he's not the only one who suffers with, he's an extreme case, but he's not the only extreme case.
Yeah. Well, and I think it's significant to note that Oklahoma is number 2 in mental illness. In the United States, we are 46th in funding. We were 48th. We've recently slipped into 46th, so that's coming up a little bit. That's a good thing. We have a long ways to go. My experience since this has happened has been overwhelming. Considering the number of families that have come up to me the day my husband was lying in state at the Capitol, to going to the grocery store or restaurant, that people are saying to me, thank you for speaking out on mental illness. It's overwhelming. And I'm talking about from the quiet neighbor to the most successful men and women in this state.
There's a dire need for it, no
doubt.
Dire
need. So you either have it in your family or you know a family. Every family is touched in some way.
Yeah. Well, Cathy and Anna Marie, thank you so much for being here with us today and talking about this and keeping this issue at the forefront and in the spotlight, because like we discussed, so many people are affected by it.
We're passionate and excited to help our fellow Oklahomans. We don't want to see another family go through the tragedy we've had.
We're not going away.
Nope.
Yes.